everyone, I'm Dr Ramya Mohan. I'm a senior consultant, board certified child and adolescent psychiatrist working across Europe and Asia. Over my decades of experience working with children, young people and families, I've come across a myriad of problems ranging from exam stress or sleep difficulties in children to more severe mental health problems like anxiety, depression, psychotic illnesses, etc. I thought it'd be quite helpful to bring around a series introducing some of the common mental health difficulties faced by children and young people today. So I thought I would start off by thinking a bit about some of the terminologies that we come across when we talk about mental health in general and child and adolescent mental health in particular. So let's stop for a minute to think about that. Some of the commonest terms we hear are counselors, therapists, psychologists, psychiatrists. A counselor is somebody, it's a rather broad term, it's an umbrella term for those who are trained to support in terms of emotional or behavioral difficulties, thoughts and feelings at an entry level. They're able to understand what the difficulty is, see if there's anything that could be done in a supportive manner, and support signposting and access to more specialist mental health as required. A psychologist is somebody who is trained specifically within clinical psychology, somebody who works more specifically with thoughts and feelings and specializes further with a PhD or a doctorate within clinical psychology. A child and adolescent psychiatrist is a medical doctor. They go through their medical training, specialize first as a general psychiatrist and subspecialize further through years of training in the highly specialist area of child and adolescent psychiatry. At the end of this, there is a board certification usually. So now that we've understood some of the common terminologies when it comes to child and adolescent mental health, let's stop for a minute to think about what stops us from accessing help. Some of the commonest things we come across is, I'm sure it will go away. It won't last for very long. It's probably a passing phase. And whilst that might be true in some cases, in many cases, it doesn't just stop at that. So it's really important for us to overcome any kind of hindrance to accessing services, as the case may be. There might be a bit of stigma and taboo. It is acceptable that there is a degree of stigma and taboo within mental health. That's been the case. But unfortunately, brushing it under the carpet does not make it go away. The lumps under the carpet show. So it's really important that it's dealt with in a timely manner by accessing support and help at the right time to prevent the problem from becoming more of an insurmountable difficulty. So let's start off this series really with a very important message. It's really important to seek timely help and intervention when we feel that we or our child or a family member or a friend is struggling. That is the first thing. And when we do actually access support or specialist help, as the case may be, it's really important to be open and communicative. And equally, I think the professionals who work with your child or with yourself or with somebody you know need to be working together closely and collaboratively to help you in the best way possible. Stay tuned for more information.